March 4th, 2013 was the day the healthcare world stood still. That morning, newsstands across the country proclaimed on the cover of Time, "Bitter Pill, Why Medical Bills Are Killing Us." The article's author, Stephen Brill, won the 2014 National Magazine Award for Public Interest for taking the lid off the nation's exorbitant, then $3 trillion healthcare system, and how it was responsible for 60% of the nation's personal bankruptcies. But a not-so-funny thing happened on the way to publishing his follow-up book, America's Bitter Pill. Brill was diagnosed with an aortic aneurysm. Suddenly, as he wrote in the book's opening chapter, when it's your life, or your child's life, or your mother's life, on the receiving end of those amazing things the healthcare system can provide, there is no such thing as a runaway cost, even when it's not an emergency. Even those who would otherwise be the toughest customer lose their leverage. And that brings us to today's political battle that's raging on how to control America's now $3.5 trillion cost of care. Medicare for all or transparency? According to Politico, on July 1st, following the second debate, Democratic centrist Joe Biden's strong lead dropped to 22% among registered Democrats and Democratic-leaning independents. So now 3 of the top 4 contenders for the party's nomination are senators firmly in the Medicare for all camp. Kamala Harris is now in second place to Biden at 17%. Elizabeth Warren is in third with 15%, followed by Bernie Sanders with 14%. While, of course, Medicare for All wouldn't automatically shrink the country's healthcare tab, after all, America's doctors, caregivers, medical device, diagnostic, and pharmaceutical companies won't start working for free. But if Uncle Sam suddenly became the employer or primary purchaser of all of them, potentially a lid could be put on the sector's growth rate. Meanwhile, with 16 months to go before the election, the Republican administration is addressing the cost issue with an executive order that aims to lower healthcare costs by creating greater price transparency. The central issue is that if Americans have a clear idea of what their care will cost before they receive it, they'll be empowered as informed consumers to make wise choices. According to President Trump, the order directs HHS to develop rules requiring hospitals to publish prices that reflect what people actually pay for services in a way that's clear, straightforward, and accessible to all. Even NPR agreed that the rules could prompt healthcare to operate more in a way where patient behavior is driven by quality and price. If only it were this easy. As of January 1st of this year, every hospital in the country was mandated to make public a list of their standard charges via the internet in a machine-readable format and to update this information at least annually. So now, after a fair amount of searching for Cedars-Sinai's 7,130 line item ancillary and room and board charge master, you can locate, for example, the price of a semi-private room, $8,534 per day, and separately listed pharmaceutical charges if you know what drugs, ancillaries, tests, devices, etc. will be used during your stay. Oh, and then there's a charge for the surgical team and the anesthesiologist. Without procedural bundles, this information is virtually meaningless, particularly since over 91% of Americans and even a higher percentage of Californians are covered by either employer-based insurance or governmental coverage. So the real issue for most of us is, what do we owe the hospital after our health care plans paid their share? And we're left with a deductible copay and coinsurance. It all goes back to Stephen Brill's conclusion, and a couple of months ago, singer Kelly Clarkson's experience. Just hours after hosting and performing at the Billboard Music Awards in Las Vegas while suffering with pain from appendicitis, Kelly flew to Cedars in LA to have an appendectomy. Chances are excellent she didn't first check the charge master. Not surprisingly, industry groups have their concerns about this new executive order, most echoing the response of the CEO of American Hospital Association. Publicly posting privately negotiated rates could in fact undermine the competitive forces of private market dynamics and result in increased prices. Given that 67% of Americans polled last year by the Kaiser Family Foundation said they are worried about unexpected medical bills, one might conclude that the industry is adapting measures to provide true billing transparency would be an easier bitter pill to swallow than the looming alternative.